Okay, Honorable Dr. Leah Tedessa, Health Minister of the Federal Democratic Republic of Ethiopia, Dr. Soshay Sugu and Betty Zazu, Academic and Research Vice Provost of St. Paul's Hospital Millennium Medical College, Professor Wang Jian, President of the Second Affiliated Hospital, Zhejiang University School of Medicine, honorable guests, ladies and gentlemen, I'm Ma Yao, an algorithm engineer from Alibaba Health. I'll be the host of the webinar today. Thank you so much for coming. So, together with the Jack Ma Foundation and Alibaba Foundation, as part of our Global Meta Exchange for Combating COVID-19 program, known as GMCC, Alibaba Health is greatly honored to organize this webinar today. And the webinar between St. Paul's Hospital Millennium Medical College and the Second Affiliated Hospital, Zhejiang University School of Medicine. The GMCC program aims to facilitate online communication, collaboration across borders, and provide necessary communication channels to share practical experience about fighting COVID-19 for frontline medical teams around the world. To the end, Alibaba Health has invited multidisciplinary team to share their experience in managing COVID-19. The team is from one of our best hospitals in China, which is the Second Affiliated Hospital, Zhejiang University School of Medicine. So, let's introduce the team. First of all, Professor Wang Jian. He's the president of Second Affiliated Hospital, Zhejiang University School of Medicine, and he's also the chair of the hospital's COVID-19 response steering committee. Welcome, Professor.
Okay, thank you.
Okay, so next we have Professor Huang Jian. He's the vice president of Second Affiliated Hospital, Zhejiang University School of Medicine. He's also the oncology and chair of the hospital's COVID-19 response working committee. Welcome, Professor Huang.
Hello.
Next, we have Mrs. Lu Qun. She is director of Infection Management Department of the hospital. She's also an expert commissioned by National Health Commission to Wuhan. Welcome, Ms. Lu. Hello. She's on screen. Hi.
She's the other side of things.
Okay.
She still be quarantined in a hotel, just came back from Wuhan.
All right, okay. Hi. So next we have Dr. Xu Feng. He's the director of Infectious Disease Department of the hospital. He's also the director of the expert panel of hospital's COVID-19 response committee. Welcome, Dr. Xu. Last but not least, we have two doctors. One is Xu Donghang. Dr. Xu Donghang is the West Director of Pharmacy Department of the hospital. He's one of the member of hospital's expert team on COVID-19. Thank you for coming, Dr. Xu. Yeah. We also have Dr. Lu Xiao. He's an attending physician of emergency ICU, who is also group leader of the hospital medical team sent to Wuhan. Thank you so much for coming.
Hello.
The Ethiopia side, we have Dr. Leah Tedessa. She's the Health Minister of Federal Democratic Republic of Ethiopia. Thank you so much for joining us, Dr. Leah. And we also have Dr. Sushi Sugu. So meanwhile, we have Dr. Shi colleagues from the St. Paul's Hospital. St. Paul Hospital also invited medical directors and COVID-19 response coordinators from 22 other hospitals. These hospitals were designated by the Minister of Health as COVID-19 treatment centers. Thank you all for participating in today's exchange on health preparations hospital needs to do to contain and manage the COVID-19. We hope today's session will set a great and good foundation for the further exchange between medics from both countries, so we can fight the COVID-19 together. Now, I'd like to invite Dr. Leah, the Health Minister of Federal Democratic Republic of Ethiopia, to say a few opening remarks. Dr. Leah, please.
Thank you very much for the opportunity. It's really great to be here, and thank you, Professor Wang, President of the Second Affiliated Hospital, Zhejiang University School of Medicine, and thank you, Alibaba Health and Jack Ma Foundation, for arranging this discussion today. I also would like to thank my colleagues at St. Paul Hospital Millennium Medical College, the Provost, Dr. Wangimageng, who I have seen has joined, and also Dr. Sisai, Vice Provost of Academic and Research, for all the leadership of all of you in arranging also many hospitals also who have joined online today. The cooperation really has been guided by a strong leadership and strong partnership between our Prime Minister, His Excellency Prime Minister Abiy, and Mr. Jack Ma. And among the many supports that has been done the past few weeks, today's discussion represents one of these many areas where our two countries are in close collaboration. And we are very hopeful that together we can better fight this outbreak globally and save many lives. And just to say brief words on the status of COVID outbreak in Ethiopia, since the first case was confirmed in Ethiopia on March 13, we have now reached to 65 cases today, and we've had some recovery, around 4 of them who have recovered and 2 have passed away. And the government has been really trying to lead this preparedness and response with the leadership starting from our Prime Minister, His Excellency PM Abiy, and all the cabinet who are involved in the response. And the Minister of Health, of course, is leading the overall outbreak response as a national command response team with a public health institute, and all of the institutions, health facilities in all the regions are part of this overall response in terms of ensuring we're doing more testing and isolation treatment in designated facilities, and ensuring that we have the necessary workforce and training for our needed for the response. Of course, there are many challenges. I'm sure that will be discussed later, but especially the access to infection prevention control, access to PPE, and also ensuring that we have strong ICU care in many of our facilities is one of our big challenges that we are trying to address. And also expansion of testing is one of the areas that is a key priority areas that we are focusing on, while the government is also taking a lot of measures in terms of ensuring prevention as a key role in the society, especially the use of social distancing and other measures to ensure social distancing have been taking place. So we are really impressed by how China has really performed in this outbreak response with many challenges and the large population that you are able to really contain in a short time with a very aggressive approach, and it has been an exemplary for many around the globe. So with this collaboration, we really look forward to hear a lot of practical lessons from how you were able to mitigate and suppress this outbreak to the status that you have now, where the current really status is really amazing. So we look forward to get through the exchange also today that we get a lot of information from you, and also we will provide our experiences so far. Our team and our health workforce who are engaged in this response will also provide some information of what we are facing. And I believe it was also Jack Ma who has said China has hard-earned lessons that it can share with the world and with Ethiopia. So we are really looking forward to that. And more than ever, I think this is the time where the globe needs more cooperation. Global leadership, global solidarity is needed to solve this global challenge, and a time to learn from each other to defeat this really grave pandemic that we are having. So we're also looking forward to embrace new technologies in this fight. And we appreciate, on behalf of the Minister of Health and the government of Ethiopia, I'm very glad that the Jack Ma Foundation has offered this a new platform for the world to connect. So finally, I hope that this session marks the beginning and not the end of our discussions. and I will be able to stay for part of this session, and I'd like to apologize ahead of time. But this is really an exciting opportunity, and I recommend this conversation to continue, this exchange to continue on this global media exchange platform that has been established. Thank you very much.
Thank you so much, Dr. Leah. I feel this is a great conversation with you, and so we can fight the COVID-19 together and to get a better result and contain the COVID-19 together. Thank you so much. So next I'd like to invite Professor Wang Jinan to say a few opening remarks. Professor Wang Jinan is the president of the second affiliated hospital, Zhejiang University School of Medicine. So, Professor, please.
Okay. Dear Dr. Leah, Dr. Sashi, all dear friends from Ethiopia, it's my great honor to have the opportunity to share with you some of our experience in the prevention and control of COVID-19. So our hospital has a long-term friendship with the Outbreak. Since 1970s, we have sent over more than 70 medical staff to 5 African countries for medical assistance. Now, 2 of our doctors are still working in Mali. In fact, it's not the first time we fight against the infectious disease together with African friends. 2 experts of our hospital have been to Africa for fighting Ebola several years ago. So one of them is Dr. Xu, next to me. And also Dr. Lu. Dr. Lu is both of them into different countries, like Mali and where's your country you've been? Sierra Leone to fight Ebola. Seeing the outbreak of COVID-19 in China, on top of receiving and screening huge numbers of patients, we sent 180 medical professionals to Wuhan. They took full responsibility to operate a makeshift intensive care units, where ordinary ward need to be quickly converted into ICU to treat the most critical and severe patients. Up to this date, we haven't had any medical staff who got infected while treating our patients, nor had they missed out on our suspected cases. As our President Xi always say, we human beings live in a community of shared future. The whole world is fighting the same battle against one common enemy, the virus. Finally, I hope with our joint efforts, we can win the fight against COVID-19 soon. We cherish the profound friendship between our hospital and Africa. That was forged more than 15 years ago, and look forward for more collaboration with you in the future. Thank you so much, all of friends.
Thank you so much. For today's session, we'll first have a presentation by Professor Wang Jinan on hospital strategies to prevent and control COVID-19, and it will be followed by a Q&A session. To ensure the sound quality of the presentation, I'd like to ask all participants to hold your question at the end of the presentation, and please put your phones on mute for now. Thank you so much. Okay, so without further ado, please let me invite Professor Wang to give his presentation. Thank you.
Thank you. It's my honor to have the opportunity to share my slides. The title of my slides is Hospital Strategies to Prevent and Control COVID-19. The first thing during the time of the outbreak, For hospital management, it's very important to set up task forces in response to the outbreak. Hospital set up the 8 functional forces, 8 functional teams during the outbreak, including the epidemiology, investigation, and the quarantine team, like the hospital infection control, like the information center, like the donation team, etc. But however, there are 2 main purposes. So during that time, for the hospital management, most important first one is protection of your staff, then properly management of your patients. So how to protect your staff? First one, I still want to emphasize the use of the masks, facial masks. So there are 3 reasons. The first one is we know there are many patients and they are in incubation period. So during that time, the patient may not have symptoms. So now there are more and more patients, maybe around 5% of patients. They are asymptomatic patients. So they don't have symptoms. So nobody knows they are infected or not. Also, we get some information. We know the aerosol or droplets in the eye may cause the infection. So if the facial masks are not available, some kind of the closed face cover is recommended, especially when you have the mask gathering or you are face-to-face somebody else. So you don't know what is the situation about the people just facing you. It's a better way to use the facial mask or facial cover. Another important element is during the outbreak of time, is to centralize the staff management. And in our hospital, we build our staff pipeline. So we try to most of those medical staff from the internal medicine related specialists, but even some from the surgical department. So we need to build a staff pipeline. We need to train those doctors well, let them know let them to understand the COVID-19 and how to treat these kind of patients, how to prevent the infection, etc. So all of those medical staff, they are working in for the fever clinic. They are working for isolation ward. They are working for sampling. So they are working for the testing. So usually, because we don't want our staff to be too fatigued. You know, if staff is too fatigued, may easy to catch the infection. So usually our hospital policy is 4 hours for each shift. You know, our staff, they are working in the fever clinic to wear the protecting material. It's not so easy for them. It's not so intolerable when they wear them so long time. So our policy is 4 hours for each shift. All of those staff will be controlled and managed by infectious disease department. The one of our policy is for all of those staff, they are working in this place. They're working in this highly dangerous place. Usually, hospital provide accommodation for their staying. So usually, when they finish work, they don't go home. They just stay in the hospital rent the rooms for them to stay in. So when they finish all of jobs, before they are go back to home or go back to the original job, we need to quarantine them for 14 days, for 2 weeks in a hotel. So try our best to prevent crossover infection. During the time of outbreak, you need to take care of all of your staffs, especially about their health. Any staff may got some kind of symptoms, so it's very important. We let every staff working in our hospital need to report their healthy status, and also their traveling history every day. So until now, we still keep the regulation. So every morning, everybody need to input your information on your mobile. So for some staff, they never use the mobile. They can fill some kind of forms. But for 98% of our staff, they have mobile phone, so they can just report their healthy status through their phone. We pay a lot of attention about the staff's travel history. We want everybody to report where they have been outside, especially outside the province or outside our city. Have you been in Wuhan? Do you know? Used to be Wuhan is a dangerous place. All nowadays we let them to report to us where they have been overseas. So this kind of the epidemiology investigation looks very important, even to your medical staff. Another important strategy is to how to use the PPE, especially initial the time of the outbreak. Always short of PPE. So for the hospital management, you have to make a lot of effort to properly use the PPE. So usually we let the hospital infection control committee to assess the circumstances and develop a tailored policy of personnel protective management for whole hospital, based on 5 elements. First one is the risk of exposure, then the severity of the epidemic, then the characteristic of patients you treat, you are facing. The fourth one is the availability of the resources. You have plenty of resources or not. Then the national guidelines. So we send almost 200 staff members to Wuhan. So all of the members sent by our hospital, we need to supply their PPE. So they are our priority, absolutely. First, we need to keep enough resources of PPE for them. In our practicing, we classified our staff posts into 3 levels. So level 1 means not so exposable. Level 2 means moderate exposable. Level 3 means a highly dangerous post, a highly dangerous job. So they need the highest level of the PPE. The second thing is how to properly management of our patients. Okay. Hospital is the main of our strategy is space management, or we calling the space controlling. We need to separate way in and way out. So check the temperature, body temperature for everybody they want to get in the hospital. In hospital, we set up dedicated CT examination room in an isolated space, in an isolated area, where it's very close to the fever clinic. So we expanded our fever clinic space. We try to open we try to convert the regular ward into the isolation ward, several regular ward into the isolation ward. We facilitated a lot to the fever clinic. Like inside the fever clinic area, we set up the pharmacy, we set up the lab test, we set up the we set up the DR, the regular X-ray. So all of those facilitation is very good for the running of the fever clinic. So for those patients with the fever, they don't need to go everywhere in the hospital. So may cause the out-body infection. All of fever patients with a body temperature minus 37.5, they need to go to the fever clinic. For those the emergency cases with the fever, we set two parts in the emergency room. The one part is for the emergency case with the fever. The other part is the emergency case without fever. So it's easy for us to screen those patients. This one is epidemiology survey form. So when we screen patients, whether they are highly suspicious or confirmed cases, we need to let all of them to answer those questions. So like where have you been traveled? So have you been Wuhan, Hubei, or overseas? Do you take the public transportation or you take the private transportation coming from our cities? So as we know, that if you take the public transportation, maybe you are a highly exposable person. So have you contact with the confirmed cases or highly suspicious cases? So do you have fever or other respiratory symptoms during the last 14 days? During the time of the outbreak, it's not so easy to treat the regular patients. So for most of the chronic disease patient, we give them a long time the prescription, like the hypertensive patient, like the atherosclerosis patient. So for those kind of patients, they are quite stable. So we don't allow, we persuade them not come to hospital so frequent. So the government insurance company, they exchange their policy. They allow the medical staff to give the 3 months prescription. So for the other patient, they want to have a surgery. For the very stable patient, so we persuade them not to come to hospital to do the regular surgery. Maybe they just wait for the disappear of the outbreak. For the emergency surgery, including trauma, stroke, like the acute surgeries and other acute surgeries, our staff just try our best to do the surgery for the patients. But all of those medical staff, they have a highest level of the protection equipment because we don't know the patient we treat. We do the surgery, it's a COVID-19 patient or not. For some patients, we call the semi-elective surgeries. For all of those semi-elective surgeries, for all of those patients coming for semi-elective surgeries, such as the tumor resection, the vascular surgery, not so critical, but they still want doctors to do the surgery as soon as possible. So for this kind of patients, we regularly do the screen test. We do the PCR test. For those patients, when they need the intubation, we do both. We do the PCR. We also do the chest imaging to see if there are any sign of the virus pneumonia. During the hard time of the outbreak, we suspended some kind of the clinical procedures and examinations, like the dental care. Actually, we stopped the regular dental care, except it's a critical cases, an emergency case with the dental care. We suspended the ENT clinic. We suspend the pulmonary function tests. We even suspend the endoscopy. But just 1 month ago, we started endoscopy again. What we do is suspected and confirmed cases. So for these suspected patients, if they have a positive epidemiologic history and a clinical manifestation, usually we isolate those patients at a hospital in one area. We do the test, PCR test. We are waiting for the test result to come out. So if the test, the twice PCR tests are normal, not positive, or negative, so it's goes through the routine medical care. If one time positive, we isolate this patient in usually in single room or single space. We repeat the test, but the 2 tests need a separate for 24 hours. For those confirmed patients, we hospitalize them in an isolation ward. So some ward with facilitated with the negative pressure ward. If without negative pressure, doesn't matter. Just very important, keep the confirmed cases in a ward. So same time, we report to the CDC. We do a lot of job to help CDC to trace close contacts with the confirmed cases. What is the standard for confirmed patient be discharged? So what is our standard policy? Including 4 elements. The first one is significant improvement in respiratory symptoms. Second one is body temperature return to normal for at least 3 days. Everybody need to do, before they are discharged, need to have a pulmonary imaging, usually CT scan. So make sure the lesion already gone, especially the exudation will disappear. Absolutely most important is they need a test, PCR test. Need to be at least twice are negative, but each test will be taken with a 24-hour interval. So of all of those patients who meet a discharge criteria, the regular policy in China, we still keep those patients, we still quarantine those patients for another 14 days. All of patients need to be back to hospital the second week and the 4th week after discharge. We just finished a brochure. The name of the brochure is COVID-19 Outbreak Hospital Response Strategy. So we are going to release tomorrow. Hopefully, the book will be give you a good hand to help you to fight against the COVID-19. So thank you for all of your attention. Thank you so much.
Thank you, Professor. So let's move on to the Q&A session. For the Q&A session, it's our pleasure to invite Professor Huang Jian to host our joint Q&A session. So for this session, we have already collected some questions from Ethiopia, from the doctors and hospitals already. We'll go through these questions first and then move on to the opening up questions for from Ethiopia. And let me introduce Professor Huang Jian. He's the Vice President of Second Affiliated Hospital, Zhejiang University School of Medicine. He's also the Professor of Oncology and Chair of the Hospital COVID-19 Response Working Committee. So, Professor Huang, please.
Okay, thank you. And we'd like to answer the questions you present. So there are friends from the Ethiopia colleagues, and the first question is about the in the case of the shortage of medical resources such as PPE and a test case, how should a hospital prioritize the use of such resources? I think the question first turn to the President Wang to answer, please.
Okay, actually I already answered in my slides. Very important, you need to give the priorities. The priorities should be given to the people working in the isolation ward, fever clinic, or the job of sampling and doing the test, and other procedures with high risk of exposure. Very important, you need to let some dedicated people to manage it and control the allocation of the PPE, avoid waste. During the outbreak of time, try to organize a special task force for donation. Don't forget, the power of society is huge. Social donation help our hospital a lot to go through the hardest time of outbreak.
Finished? Okay.
Yes, I finished the first question.
Okay. So the second question is about how do you manage the patients who are waiting for the test results and prevent infection among them? How much spaces do you allocate? I think the question will turn to the Dr. Xu, who is the head of the infectious disease department, chief physician. Dr. Xu, please.
Thank you. Thank you for your question. In our hospital, we can provide an isolation ward for each patient who are waiting for the test results. And in our hospital, one patient stay at one single room with his face mask. And during isolation, the medical staff on duty to take care of these patients, and during the peak period, we can immediately provide more than 20 rooms for these patients. Thank you.
Okay.
So the very important thing is one suspected patients, one guy in one room.
Okay, thank you. So the third question is about what training must be given to the medical staff in the different zones in the hospital. So I think I'd like to answer the question. So we have the policy to train all our medical staffs, including the physicians, nurses, medical students, residents, etc., to have specific training about the COVID-19. So for all staffs, we all know the latest requirement of the COVID-19 prevention and control, personal protection knowledge and the skills, etc. For physicians, the latest diagnosis and treatment plan, diagnosis and treatment procedures, and the disease prevention guidelines of the Chinese guidelines of COVID-19 all should be learned by each physicians and the nurses. Medical technicians, they will know the operation procedure related to the COVID-19, like PCR test or blood test, etc. Nurses, the role of nurses nursing COVID-19 patients, such as epidemiology survey, visit management, and nursing care of COVID-19 patients. The logistics staff, training of personal protection against the COVID-19, disinfection procedures of healthcare environment, including equipment, floors, etc. Also, the first-line posts of COVID-19 prevention and protection. This is a very special post. Should we pay more attention to such kind of stuff? So, target training should be conducted according to the post requirements. Just now, President Wang have mentioned that each area have a different PPE, and we have divided into 3 levels of PPE. So, especially for technical standard related diagnosis and treatment of COVID-19, operation procedures, personal protection levels, and the protection procedures, etc. So all should be posted and also should be noticed each physician and works, so they all follow our hospital policy to prevent and control the COVID-19. That's my answer. So now we turn to the fourth question, please. Fourth. Turn down. Oh, okay. Fourth, can medical staff who are working with COVID-19 patients in fever clinic work in other departments and with other patients in the hospital? This question turn to the President Wang, please.
Okay. Just like, actually, I already mentioned in my slides presentation, for those medical staff, they are working in the fever clinic or isolation ward, those very highly dangerous place. And usually, we hospital provide accommodation. They don't allow, they will not be allowed to stay with other medical staff. They are not working in this area. So usually they have a separate place for eating meals. Hospital rent rooms from hotel to quarantine them at night. They just stay in the hotel. So if they finish their job, they would like to go home or back to the original job. They need to be quarantined for 14 days. Also, usually for everybody, we do the test, do the PCR test. If the PCR test are negative, during the 14 days, they don't have any symptoms, should be okay. They can go back to the original job, their original job, or go to home to meet his family members. For like the Wuhan team, we send our team to the Wuhan. They already be back actually 10 days ago, but after they are coming back, all of them be quarantined in a hotel for 14 days. So now they have possibly 5 more days. They will come back to hospital and to meet their family.
Okay, thank you. So the fifth question, I'd like to answer the fifth question. What is the doctor-patient nurses ratio? So the ratio is dependent on the working area of the physician or nurses. So in the ICU department, the doctor to patient ratio is usually a team of doctors will take care of 10 to 12 pairs. One doctor will see 20 to 30 outpatients within 4 hours. Nurse to patient ratio. Inpatients 1 to 5 depend on workload. Outpatients 1 to 20 to 25 depending on working load. So for the fever clinic, we usually with the 1 doctor 10 patients ratio. Within 4 hours, each shift is same ratio. So that's the answer. Thank you. So I'd like to answer the 6th question. Are there any particular types of patients to pay different attention to? It's such example, pregnant women, children, and elderly people. Now the question to the Dr. Xu, please.
Okay. Health patients might have atypical or some slight clinical presentations. So, for example, they show the normal body temperature or some actual pulmonary syndromes. So, for the elder patients, they need a lot of attentions. And it's suggested that for elder patients, they will be done for detection, RT-PCR for detection, nucleic acid test if needed. And for some pregnant women or children, we suggest them should be firstly get some detections, for example, nucleic acid detection by RT-PCR and antibody against the coronavirus detection is firstly. And sometimes for these patients, radiology examinations, including chest X-ray or CT scan, should be deleted. Thank you.
Thank you, Dr. Xu. And I'd like to also invite other parts of the doctors from come back from Wuhan. Can you answer some questions in 6 questions? Any additional answers to the questions?
For older patients, for pregnant women, for children?
Yeah, we do not have any experience for the pregnant women or children in Wuhan, but there are many older patients in our ICU in Wuhan, and the older patients have the high mortality than the younger patient. We have this experience, and if the older patient have the intubation, most of them will be dead from the COVID-19. So as we said before, we must pay attention to the older patients. If they have the symptoms or the suspect the COVID-19, we will include them the early time and treat in the early time. Thank you.
So I would like to add something for the elderly patients. In Wuhan, my team members, they treated one patient, a couple. The guy is 98 years old. Actually, his wife is 87. So possibly they are the oldest couple in China with COVID-19. So very important, the regular treatment maybe not so intolerable, maybe not intolerable for the old patients. So like this couple, we stop the antivirus medication because antivirus medication causes so big side effects for the elderly patients. So for this kind of patients, we need to do case by case. So we withdraw the antivirus medications, we stop some of the other medications, but the couple getting better. At last, both of them were discharged. Okay.
Okay, we have finished all the 6 questions. I hope it will be helpful to your side from Ethiopia. So now it's open for the question from the Ethiopia side. Please, do you have any question? We'd like to answer.
Actually, Professor Huang, they already sent some questions
Okay.
through the website.
Website?
Website,
Yeah,
okay.
so let me clarify them. So first, for the suspected cases, what do you think the size of isolations? But we need to consider the size of the Ethiopia's hospitals. They usually have like less than 400 beds or 300 beds. So how do you think the size of isolations?
Size of isolation. Do you know our hospital are 200 beds? So we set up the 300 beds.
Yes.
300 beds for the functions of isolation bed. But depends. I think for the 400 beds, maybe you need to take 10%, 15% of your beds for isolation of highly suspicious patients or isolation of the confirmed cases. For confirmed cases, you can put several confirmed cases in a single room, But for the difficulty is for the highly suspicious cases, because you are not being confirmed, so that you need to for those patients, you need to provide a single space for highly suspicious patients.
Right. So we also have a, with the ward and the clinic together. So we have a fever clinic and an emergency clinic for specific patients with fever and the suspected patients. So if the patient is suspected, we have a special room for the sampling. And then after sampling, we'll go to the isolation ward. So that's a process of the whole management of the suspected cases. And also we leave some ICU ward for the emergency cases, with emergency suspect cases. So we have at least 10, we have 2 campuses, at least 10 wards, ICU wards with pressure, negative pressure to isolate the suspected cases.
But it's better to let your patients keep the distance. Usually, in our regulations, at least 1 meter apart, the 2 patients. If it's okay for a patient, let the patient wear the facial mask.
Boshi, do you have any question? Any answer?
Okay.
No. Okay.
Okay, so for friends in Ethiopia, did these answer your questions? Can we move on to the next one? Okay, so we move on to the next one. How do you manage recovered patients when they can be released?
Already since the edition of the national guideline, and actually I already presented on my slides clearly the 4 elements. The first one is the symptoms need to be gone. Then the fever, the body temperature need to be back to the normal for at least 3 days. Then the PCR test need to be negative for at least twice test. Each test need to be 24 hours separately. Then the CT scan of the lung or the DR. If you don't have CT, you can do the DR. The transudation need to be disappeared. Okay. Then in Chinese policy, we still after discharge, we still quarantine those people in a central quarantine for 14 days. Right?
Yeah. Yes. Exactly.
Okay, so let's move on. So for the recovered patients, and how do you prevent them from being reinfected?
I'm not an expert actually, and I let other experts to answer the question. Is it better? Who is going to? Oh, Dr. Xi. Dr. Xu is the chief of infectious disease department of our hospital. 2 years ago, he went to Sierra Leone to fight Ebola.
Okay. I try to answer your question. And your question is how to prevent patients from being reinfected. And for the patient, for the recovery patient, they as talked by President Wang, they should stay at a central quarantine hotel for at least 2 weeks. After that, they can go to the routine work and the original work position. And for them, very important things is one, still wear face mask. Two, wash their hands regularly. Three, the third thing is still keep social distance. At least 1 meter away between 2 persons. And for according these suggestions, the recovered patients will be safe. And another thing for the recovered patients, the antibodies, the protective antibodies for IgG against the coronavirus should be come out in most of recovered patients. This antibody will be very helpful against prevent them from reinfection. Thanks.
So actually in Wuhan, they regularly check the patients be discharged. So also 100% they have immunity. So they can, IgM are positive, IgG and IgM are positive. Dr. Wu Xiao.
Yes.
So would you have something for the question, please?
Yes. First, I think you will the patient when the patient discharged, they will quarantine for 2 weeks, and some patients will most of the patients will have the PCR test again before they release the quarantine, and to make sure the PCR test is the negative. And of course, as the professor once said, that before they discharge from the hospital, we will test their antibiotics and to make sure it's if it is positive, and we will make sure if the PCR, because some doctor to make the PCR test is the negative, but we must make sure if this is the real negative. Some test is there have been some results is the false negative, so we will try to test more than twice or 3 times for the patient. Thank you.
So what is the meaning of the IgM in serum? If the patient has a positive IgM, so means they have immunity.
They have infected recently.
他们不会感染吗？那 IgM is
infected recently.
Oh, what is about the IgG? IgG. What is the meaning of IgG? If those kind of patients they have a IgG positive, means they have an immunity.
Yeah.
他们是不是说明他们有免疫力？
对，就已经感染过了。
They have an antibody.
既往感染和有免疫力还是不完全一样的，就他既往感染了，是不是有免疫力？ Any studies?
Yeah. I mean, possibly they have the immunity power to the COVID-19, but but some of our patients is the antibiotics is negative, so it's I think it's easier to have infect again, maybe, so we will just not discharge this patient.
Okay. So next question.
Next question is, do you test every patient admitted to the hospital? Do you test every patient?
Actually, during the hard time of outbreak, we tested almost everybody admitted in the inpatient department. But later, recently we changed our policy because the situation in our culture is becoming much better than before. So now we only do some patients only need surgery, especially they need the general anesthesiology for intubation, for those big surgery, for some procedure related to the pharyngeal or bronchial, some kind of the procedure. For those kind of patients, they need a test. For regular patients, now we don't do any tests for them.
So PCR nucleic acid test is very important, especially during the first outbreak of the COVID-19. But if the patient is emergency for operation or something else, we should do two PCR tests, also do operation at the same time, and but with the highest PPE for the physicians and also for our other staffs. So now the incidence, the outbreak now is controlled. So we have less people with PCR test because we have a very very confirmed epidemiologic investigation, and also no symptoms and no fevers, and also we have a green coder. If the patient with a health condition, with the government will give them a green coder. It's based on the big data. So all these kind of patients, we will omit the PCR test. So that's why we now have less people have the PCR test. And at the beginning, we have every patient will have give the PCR test. So that's the way our policy will gradually release and will omit the PCR test recently for some kind of patients.
Okay. So today we have a pharmacist join us. So do you have any questions for the pharmacy? For pharmacy. So pharmacist, Mr. Xu is here. Any more questions for him? So he never answered the question. Okay.
I think probably give them some time to prepare the questions. And
okay.
Later on.
Good.
Okay. So the next question is, how do you manage patients with asthma, asthma?
Asthma.
合并哮喘应该。
许峰，你讲回答。
Asthma capability.
你要来回答 asthma。
它在合并了
COVID
你要讲的特点。
COVID.
Maybe I simply let Dr. Lu answer the question. So because he had an experience to treating patients. So do you meet any patients with COVID-19 symptoms with the asthma? So what kind of special treatment do you use?
We do not have any patients with asthma, but we have the patients with COPD. Some old patients with COPD, and I think the lung function is decreased before they infect the COVID-19. So after the infection, maybe it's just decreased severely. So maybe this patient will be intubation at the early time. And after intubation, if this patient is the older patient, I think it's hard to weaning the ventilator. So they will be long term to have the ventilator treatment. Maybe and the prognosis is not so good.
哮喘有什么特别治疗？
我可能没研究，我想这一定有不一样的地方。There are quite funny phenomena for the COVID-19 patients. Looks like they are more tolerable to the hypoxemia than the other patients, right? When their saturation is lower than 90, like around 85, they still can walk in the work. That's right?
Yeah. Yes.
So why? So what is the reason for that?
We do not know, because we have found the symptoms of most of our patients. They are so high tolerance of hypoglycemia, they can drink, and people, but the CT scan shows the severe ARDS maybe, and so it's hard to diagnosis of these patients if this patient need the intubation, or they just treated with the non-invasive ventilator or the high flow. I think if the patient have infected with COVID-19 and asthma, if this asthma is not acute asthma, I think it will be okay. Only maybe use some steroid just during the treatment will be okay for those patients.
And I think for these patients, COVID patients with asthma, and for this patient just got mild asthma, we just use the anti-asthma drugs as routine. And for the clinical patients, ill patients, I think oxygen therapy or BiPAP is used as if needed. And sometimes these patients should be got a lot of attention and keep being monitored all the time. If meet emergency conditions, these patients should be get mechanical ventilation as soon as possible in order to decrease their mortality rate. Thank you.
Okay, next question.
Okay, so do you use any chemoprophylaxis for medical staffs?
化学预防。
最近啊，就是有用那个中药 Chinese，
你不用说英文，你就说中文。
用中药来进行预防啊，也取得了比较好的效果啊。那个现在就做了一个统一的方子啊，在中国的医务人员啊，包括一些签的一些病人中获得一些非常好的效果啊。但是呢，就是说对一些比如说一些抗病毒的药物来进行预防啊，目前还没有一些相关的证据来证明啊，也取得比较好的效果啊。也有一些小的研究看上去好像是有一个好的效果，但是呢，可能这些都需要一些大的研究，或者说多中心的来证明啊，它的预防是有效果的啊。回答我们。
So I just add some answers. I translated some answers to the Ethiopian compound. So is there no specific drugs for the prevention of the COVID-19, at least now? So in China, we have a special drug like Chinese herbals to prevent, but still lack of very evidence now. Not still just personal experience for that. And I think use Chinese herb mainly focus on the immunity, to improve the immunity of the people, the population, and then the virus. So for the for the antivirus drugs available now, it's not suggested to have to use for the chemo prevention at now. So I think the most easiest and the useful ways is, wear mask, social distance, and hand hygiene. That will be easy to do and very helpful, at least now. So I think we should change our lifestyle first. Thank you.
Would like to add a couple of comments. And in mainland China, Chinese traditional herb, Chinese traditional medicine is popular. Maybe we can give it a try if applicable. Another thing is we still can give it a try to use interferon alpha, inhaled interferon alpha, or get Demoxin alpha 1 injection. These drugs was used just to enhance body immunity against the potential infection, but not have any ability directly to against coronavirus. If possible, you can try.
Okay, next question, please.
Okay, so how do you deal with the patients with psychiatric disease? And how do you deal with panic of non-COVID patients in the hospital?
So this kind of psychiatric mental disorder patients, we should separate to the other area because this patient, the specific patient, need a specific care. So at that time, we not allowed the family to accompany the patients. So our staff will take care of the patients. So each patient will be isolated in single room and keep them not touch each other.
Actually, we send psychiatrists. We will send out the chief of psychiatry from our hospital to join the Wuhan team. So actually, he has a lot of abilities. For those severe mental illness patients, absolutely need to be. There are in Wuhan. There are some hospitals which just receiving these kind of patients. For the moderate to mild psychiatric problem, usually just take medications and pay more attention to those patients. Very important, try to let the psychiatrist to join the rescue team. So not just for the patients, but also for the staff psychiatry problem. We send almost 200 colleagues to there. They went to Wuhan and admit so many critical patients, so many our staff, they have a psychiatric problem. So the psychiatrist we sent joined the team, did that so great. Actually, he contributed a lot to contribute. So did a great contribution to the stabilization of our team. So psychiatrists at that time is so important.
So our staff need psychiatric support because of stress. So at least some staffs will meet the very serious cases of conditions of patients. So they need psychiatric support for our staffs. So that's very necessary. Next question, please.
So for suspected cases requiring emergency surgeries, what special precautions do you take?
Also, actually, already answered on my presentation. I would like to repeat again. For those patients coming for those patients with a critical situation, they come for surgery. We don't have time to screen them whether they are cases of whether they are COVID-19 or not COVID-19. We just treat them as quick as possible. However, every medical staff to treat the patient need to have a highest level of PPE.
Okay.
Yes.
Okay. So due to the time constraints, we have to leave one more questions. So anybody online want to ask a questions?
I understand Dr. Yakal Muchi from the Alert Medical Center has a question. Dr. Muchi?
You're
The line
welcome.
is open.
Okay, thank you. Let me ask one question. What is the rationale in use of steroids among these COVID patients?
Nationally.
Sorry.
Sorry, Dr. Muchi?
Pardon?
The rationale in use of steroids.
Rational use of steroids, right?
Steroid. 结束。
So Dr. Lucia, would you like to answer the question about the steroid for patient? What's your principle?
Okay, in our experience in Wuhan, in our ICU, we just use the steroids for the very severe patients for the short time, about 3 to 5 days, and at the very small doses. We think it can stop or just decrease the aggressive of the long aggressive of the CT scan. We just because some patients have very severe ARDS, and even after they just intubation and have the ventilator treatment, the SpO2 is still low, and they cannot maybe they cannot survive even if they have the ventilator treatment. So we give the steroid. It could increase the SpO2 after we give them 3 or 5 days. But we do not, we are not use the steroid usually for some mild patients, and it's not recommended to use in mild patients in our national guideline. Thank you.
So I would like to add something. Some infectious disease experts treating COVID-19, they told me steroids function well for these kind of patients, especially for patients when they converted from mild to moderate illness, converted to the severe situation. So just the converting, try to use the steroid as soon as possible. If the patient already 2 years, maybe the steroid not so function well. So very short time and not so big dosage. So usually they give the massive prednisone, 40 milligrams per day. So it's a low dosage. Give them for several days. Okay.
Okay.
So since we have so many questions and they're quite passionate, so can we answer 2 more questions? Is that possible to answer 2 more questions?
Just one question for our colleague in Ethiopia. So now, where's your most challenge for you if there are many patients came to your hospital? What the most you want us our help?
What's the biggest problem for you now?
By now, there are 2 very hot questions they want to ask. So the first one is, do you transport the suspected cases to other hospitals or other organizations? Do you transport the suspected cases?
In China, actually, like in Wuhan, there are so many hospitals we can treat COVID-19, but in our province, because we don't have so many cases here, the government set up several, 22 in the Hangzhou city for the designated hospital. So usually when make sure diagnosis, we transfer patient to the designated hospital. But in Wuhan, there are so many hospitals which treat the COVID-19. So our team, we send our team went to Wuhan. They take out patients in the ICU. Okay.
I think the question for our Ethiopian colleagues is, I think President Wang would like most to ask is, what are the special challenges that our Ethiopian colleagues are facing at the moment? What is the biggest problem that you see right now?
Yes, yes, this is my question.
So I don't know if any of our colleagues on the Ethiopian side would like to share, maybe from St. Paul's Hospital.
Yes, yes. As Her Excellency the Minister has mentioned, I think 3 of the top priorities and main challenges to us is access to PPE and access to emergency services, including ICU and ventilation requirement, and the other is availability of testing for all contacts. So now we are testing only limited number of patients, so those who are suspected. So, but we have also challenge in testing, availability of testing kits. So these are the biggest challenges. So protecting our health workers and availability of adequate PPE and ICUs and emergency services, as well as expansion of testing. So especially mechanical ventilators and PPE materials and testing kits are a critical challenge for us.
Okay. So the PPE, ICU, and limited space, limited room numbers.
As well as availability of also testing, probably. So what we are currently doing is the real-time PCR. So if we wanted to adopt also your discharge protocol, so it would have been better for us also to have these immunology tests like the rapid tests, IgM and IgG.
All right, so I understand you have so many questions, but the time is limited. So thank you. Since our participants has a lot of questions, I would like to refer you to the GMCC program, and which is the Global Med Exchange for Combating COVID-19. You can go to the website, which is the COVID-19 alibabaclub.com. There's International Expert Medical Communication Center, which the hospital in China also joined in, which is the second affiliated hospital, Zhejiang University School of Medicine. They also joined. So if you have questions and want to get some resources from there, you can go to the website and get this information. How's that? And if you don't have the app to scan, you can scan the QR code showed online, and then you can go to the website and ask questions from there. So, all right, I think thank you all to coming for this webinar. I hope this is going to be really helpful for you, and I think it's a foundation. So maybe later we can fight the COVID-19 together. We believe that we must share our resources and know-how and hard-learned lessons with you to win the battle against COVID-19 together. And this is the one fight, one world, one fight. So thank you so much for coming, and good night. All right.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.